Hello, I'm Shabana this side, your friend and colleague, and today I'll be discussing about the urodynamic studies and the interpretation of the graphs. This is also a very important exam topic, and I know sometimes when we get the graph in the exam, so it's very difficult for us to interpret. So again, I have tried to keep it as simple as possible. So let's have a look that what is urodynamic studies. So urodynamics, in this, like many tests or a combination of tests are done to assess the ability of the bladder and urethra to store and void urine, and these studies are done in the outpatient setting. They help to assess the function of lower urinary tract. Mainly, the studies include uroflowmetry and cystometry, and ambulatory and video urodynamics are not done routinely. What are the indications? These are done in patients with lower urinary tract symptoms, like those with symptoms of incontinence, if they have any frequency, urgency, recurrent UTI. Other indications are in patients who are having incontinence and the conservative treatments have failed in them, or they have to go for the surgery. So before surgery for incontinence, urodynamics, these studies are done, particularly if there is clinical suspicion of detrusor overactivity, or if patient had previous surgery for incontinence or prolapse, or if there are symptoms of voiding dysfunction. So we need to remember that in urge incontinence, urodynamics, these are recommended before surgical treatment. But in patients with stress urinary incontinence, urodynamic studies are not routinely recommended, particularly if pure stress urinary incontinence has been diagnosed clinically based on the history and examination. But if there is any suggestion of voiding dysfunction or prolapse or there is history of previous surgery, in that case, urodynamic studies can be done in patients with stress urinary incontinence. So before urodynamics, what should be done? We have to take the history from the patients, offer an examination, offer some important investigations, also offer her the pill, that is the patient information leaflet, and of course take her consent before doing the urodynamic studies. In the history, we have to inquire about the symptoms of incontinence, the severity, which symptom is more bothersome, and whether it is affecting the patient's quality of life. There are quality of life questionnaires we can ask them. We have to inquire about the medications like anticholinergics, diuretics, any previous surgery. Then coming to examination, we have to always offer examination. We have to do the examination always with the patient's permission and in the presence of chaperone. Very important patient safety point. And examination is done to assess for the pelvic organ prolapse, any mass, genital atrophy, how's the pelvic muscle quality, and to assess for urinary leakage. What about the investigations? We will be doing the urine analysis, the urine dipstick, bladder diary. It has to be maintained at least for 3 days. And uroflowmetry. Okay, this is also known as the free flow test. So coming to uroflowmetry, what is it? It is a very simple, non-invasive and relatively inexpensive test, and it is done to screen for voiding difficulties. How is it done? So in this, the patient is asked to void by relaxing while sitting on a commode over a Uroflowmeter. So what does it measure? We can see the graph. I mean, this the normal flow graph is here. This is the Uroflowmetry, and normally the pattern of flow has to be bell-shaped. So it measures the voided volume, the post-void residual urine volume, maximum flow rate here, pattern of flow, and it is bell-shaped. So what happens here that when the patient is asked to void, there will be rapid upstroke here, and then there will be a curve with a continuous flow, this curve. And we will see the Qmax here, the maximum flow rate, and then there will be a quick decline, okay, once, and here the voiding finishes. So the curve is like this. It is the bell-shaped curve. Coming to cystometry, this is very important. This will assess the bladder function. Also, it assesses the bladder's storage ability. It measures the pressure-volume relationship of the bladder during filling and voiding phase. Now, what is the idea of this test? The idea is to reproduce a micturition cycle while recording abdominal and bladder pressure and attempting to reproduce the patient's symptoms to come to a diagnosis. This will help us to know whether the patient is having stress, urodynamic stress incontinence or urge incontinence, or there is overactive bladder. Now, how it is then done? 3 catheters are required. You can see here, this is the filling catheter, the first catheter. This will fill the bladder with the saline, okay, saline and water, this one. Then there is a second catheter, which is inserted in the bladder to measure the bladder pressure, okay, the vesical pressure. Then third catheter, this is inserted either in the rectum or the vagina to measure the abdominal pressure. So before starting cystometry, the initial resting pressures of the bladder and abdomen are recorded. That is the P vesicle and the P abdomen. The vesicular pressure and the abdominal pressures, these are recorded. After that, the bladder is filled with normal saline. Okay, so the bladder is filled with the normal saline, this one. Then what we have to record when in the filling phase, we have to record the first sensation of filling, first desire to void, and any strong desire to void. And then we also have to calculate the detrusor pressure. How do we calculate it? This is calculated with the help of these pressure transducers. These are attached to the computer. Okay, you can see this computer over here. And then there is electronic subtraction. That is the abdominal pressure is subtracted from the vesical pressure. So detrusor pressure is equal to vesical pressure minus abdominal pressure. Okay, I hope I'm clear so far. So let's move ahead. Now, during the filling phase, patient is asked to cough, stand, jump in order to provoke the bladder. So during this phase, during these provocations, we have to see if there is any detrusor contraction or not, if there is any leakage or not. Normally, there should be no leak, there should be no detrusor muscle contraction during the filling phase. This is if there is no leak, no detrusor muscle contraction, it means that it is the normal urodynamic study. And at the end of the test, woman is asked to void for pressure or flow analysis. Let's have a look at the cystometry and the normal values. So mainly it is important for the part 2 exam, but just we should also know about this. This is something very basic. The post-void residual urine volume should be not more than 100 ml. First desire to void is at 150 to 200 ml. Strong desire is at 350 ml. The bladder capacity is 400 to 600 ml. During the filling phase, the detrusor pressure rise should not be more than 15 centimeter water. During the filling phase, there should not be detrusor contractions. There should be no leaks. In the voiding phase, of course, there is going to be little more rise in the detrusor pressure, but it should not be more than 70 centimeter of water. Uroflowmetry is bell-shaped, as we have discussed earlier. What about the peak flow rate? It is more than 15 ml per second for a volume of more than 150 ml. Okay. And we also have to take care of the urodynamic artifacts. So these are actually inaccurate measurements, and they can lead to failure of reproduction of symptoms. They can cause false negative or false positive findings. So how to avoid these artifacts or prevent them from happening? This is done by frequent equipment checks, patient's position checks. Patient can be either in the sitting or standing position. And we have to set up the calibrations well. Calibration should be at 0 for accurate measurements. Then what about these ambulatory or video urodynamics? We don't do them routinely. We do them only if after conventional urodynamics, the diagnosis is not clear. Okay, so let's see how we interpret the graph. So the basic thing is that what about the detrusor overactivity? We know detrusor overactivity means that there will be rise in the detrusor pressure and the vesical pressure, but no rise in the abdominal pressure, and there will be no leak. Then urge incontinence is where there is rise in detrusor pressure with leak, but there is no rise in abdominal pressure. Urodynamic stress incontinence is when there is rise in abdominal pressure and the vesical pressure with leak. There is no rise in detrusor pressure. And all this we have to assess in the filling phase, okay? So let's have a look at this diagram, at this graph. This is the cystometry, so we have to check for the calibration. It is at 0, okay? We have to see the filling phase and the voiding phase. So in the filling phase, when we see this pink line, this is the vesical pressure, the bladder pressure, okay? When the bladder is filled with the saline, so of course there is going to be some rise in the pressure, but not so significant. And there will be rise in the abdominal pressure also, but not so significant. What about the detrusor pressure? Nothing over here, no detrusor contraction, no rise, okay? If there will be any rise like this, it means there is detrusor overactivity, but there is nothing over here. What about the leak? There is no leak mentioned in this graph. And what about the voiding phase? So we can see here in the voiding phase, we know that there will be the detrusor pressure rise, but it should be less than 70 centimeter of water. So, and the curve has to be the bell-shaped curve. So this is normal urodynamic study. Why? Because there is no significant rise in abdominal pressure and detrusor pressure. There is no detrusor contraction here, and there is no leak. Okay, so let's see the other graph. Again, whenever we see a graph, we will see the calibration. Like, okay, there it's, okay, so 0 is not mentioned, but we can assume this as 0, okay, because this one, because there is 20, 40, 60, 80, so most likely this will be 0, okay, calibration will be set at 0, 0, 0. Now we will see the rise in the abdominal pressure. Can we see any rise, any significant rise? No. What about the bladder pressure, the vesical pressure? Do we see any rise? Yes, there is rise here, one here, another one here. What about the detrusor pressure? Here it is okay, but there is a rise here. In the filling phase, the rise in the detrusor pressure should not be more than 15 centimeter of water. And how about the rise here? It is 54. So there is significant rise. One is here, another one is here, another one is here. It means there is contraction of the detrusor muscle. There is detrusor overactivity. Is there any leak? No leak. So this is only detrusor overactivity. If there would have been any leak mentioned, it would have been urge incontinence. Okay. So this is detrusor overactivity because there is rise in the detrusor pressure here. There is rise in the vesical pressure, but there is no rise in the abdominal pressure. Fine. So let's see the other one. Now this graph again, we are going to see the calibration first. Is it set at 0? Yes. Here also 0, 0. So calibration is all right. There is no artifacts. Again, we will look at the first line, this bluish purple line, this one. This is the vesical pressure. Is there any rise in the vesical pressure? Yes, there is a rise. Here, then here is also a rise. Here is also a rise. Okay. Then what about the abdominal pressure? Is there any significant rise? No, no. What about the detrusor pressure? Is there any significant rise in the detrusor pressure? Yes. One here, another one here, another one here. Is there any leak mentioned? Okay, yes, there is leak. Leak is here. Urgency, there is urge, there is leak here, there is leak here. So, if there is detrusor overactivity plus leak, this is urge incontinence. Any leak is incontinence, we know that. So, detrusor overactivity and leak, this is urge incontinence. If abdominal pressure would have been raised and leak, it would have been urodynamic stress incontinence, right? So I hope I'm clear so far. So let's see the other graph. Again, we will see the rise, the vesical pressure. Is there any rise? Yes, there is rise. Abdominal pressure, is there any rise in the pressure? Yes, there is rise here, here, and this one also. What about the detrusor pressure? There is no rise in the detrusor pressure. There is no detrusor activity, no contraction of the detrusor muscle. What about the leak? Is there any leak? Yes, there is leak. So there is leak with rise in abdominal pressure, rise in bladder pressure. So this one is urodynamic stress incontinence. All right. So just to revise the facts, what we have learned so far. So this one, we will go from top to bottom like this. This is A, this is B, this is the graph C, this is the D1. So what do we see here? This is the abdominal pressure. Cuff, Valsalva maneuver. There is rise in the abdominal pressure, and also there is rise in the bladder pressure. What about the detrusor pressure? There is no rise, so there is no detrusor activity. What about the flow rate over here? This is the filling phase. So of course, no one is voiding. We are just filling the bladder. So it will be flat line here. This one, sorry, not all this, this one. We are talking about this one. So this is the normal bladder response. And is there any leak? No leak. This is the normal bladder response. Coming to B, what do we see here? Abdominal pressure, flat line. What about the bladder pressure? There is rise in the bladder pressure. What about the detrusor pressure? Yes, there is a rise. What about leak? The leak is visualized. So this is detrusor overactivity with leak. So it is urge incontinence. Okay. This is leak during the filling phase. Okay. Coming to C, this one. Here there is like cuff. So bladder, abdominal pressure is raised. The bladder pressure is raised. But detrusor pressure is not raised. Any leak? Yes, the leak is visualized. So when there is rise in the abdominal pressure with the bladder pressure and leak is there, so this one is urodynamic stress incontinence. Then what about this one? During the filling, what about the abdominal pressure? No rise. What about the sorry, this is the voiding phase we are discussing about. So voiding, we will see the curve, bell-shaped curve. All right. So this is the normal voiding pattern. There is a bell-shaped curve. Just to keep it very simple, how are we going to see stress incontinence in the urodynamic studies? We will see the abdominal pressure is raised. Bladder pressure is raised. Is there any leak? Yes. So what about the detrusor pressure? No, it's not raised. So this one is urodynamic stress incontinence. If detrusor pressure was also raised, it would have been mixed incontinence. Okay. Coming to this one, abdominal pressure, no, flat line. What about the vesicular pressure? Yes, it is raised. Detrusor pressure, it is raised. Leak or no leak. If the leak is present, it is urgent incontinence. If there is no leak, it is only detrusor overactivity or urgency. All right, I hope I'm clear about this interpretation of the graph. So I hope it was helpful. And there are graphs, so you can also practice them and interpret them on your own from any book or even online. So that's all today. And please do like and subscribe to my channel to get new video updates. I shall be loading more videos related to the exam, okay, whenever I am free and whenever I get the time. All right, thank you. All the best. Keep studying.